Hey signers and healthcare workers. We appreciate the hours of work and exceptional care you give. You provide so much, and we are so excited to give something back to you. This is a packed lesson focusing on healthcare signs to provide you with the basics to connect with deaf patients. So let's learn how to sign signs for healthcare workers. There are a lot of nuances to signing for healthcare. This video could honestly be 10 times longer, but I thought it wise to only cover the basics. When interpreting in the healthcare system, you have to be a highly certified interpreter because of these nuances and the importance of being able to communicate accurate information. So even though these signs are great to know for that time when you need to communicate with someone who is deaf or hard of hearing, it's even more important to understand that a highly certified interpreter is needed. I've divided these signs into two sections. First, we'll cover jobs and locations, and later we'll cover medical signs. Let's get started. Doctor or doctor. It's a flat hand touching your wrist, or a D hand. Doctor, doctor. Nurse, nurse. You're doing a flat N on the wrist like you're checking a pulse. Nurse. EMT is finger spelled, E-M-T. Paramedic is emergency medical person. Paramedic. Ambulance, ambulance. Think of the lights flashing, ambulance. Hospital, hospital. You have an H-shaped hand coming down and across like the red cross on your arm. Hospital. Clinic, clinic. Your dominant hand is a C-shaped, making the shape of a cross on your non-dominant arm. Think of the red cross. Clinic. ER, ER. You fingerspell the abbreviation emergency room, ER, ER. Waiting room, waiting room. The sign to wait and room together. Waiting room. Elevator, elevator. It's an E hand going up and down like an elevator. Elevator. Cafeteria, cafeteria. The sign is right by your mouth because it's a place that you eat. Cafeteria. Pharmacy, pharmacy. It's the sign medicine and then store put together. Pharmacy. Gift shop or gift shop. The sign gift for present and then shop or G-I-F-T shop. Doctor's office. The sign doctor and then office together. Doctor's office. Appointment or reservation. Your hands are open with the dominant twisting as they're closing in. Appointment or reservation. Floor, floor. You're showing the flat floor, and if you do it multiple times, it's floors. Floor. Wheelchair, wheelchair. It looks like a wheelchair. Wheelchair. Room, room. Your hands are making the shape of a room. Room. Stay or stay. You have Y-shaped hands and pushing it down for the thing to stay or stay. Stay. All night or overnight. Your non-dominant arm is acting as the horizon, and this is the sun throughout the night. All night or overnight. Contact, as in to get in contact with someone. Your two middle fingers are pointed out, coming in contact with each other. Contact. Family, family. It's the letter F's in a group of people. family. Insurance. Insurance. It's an I shaking back and forth. Insurance. Interpreter. Interpreter. This is the sign interpret. It kind of looks like the hands of an interpreter interpreting with an agent marker. Interpreter. Now we are going to focus on medical signs. Here we go. Emergency. Emergency. It's a shaking E hand. Emergency. Feel. Feel. Your middle finger, also known as your feeler finger, comes up on your chest. Feel. Hurt. Hurt. Now with hurt, you can move it anywhere on your body to show where there is an ache or a hurt. Hurt. Breathe. Breathe. You are showing the act of breathing in and out. Breathe. Calm. Calm. Your hands are showing the calming down. Calm. Allergies or allergic. You point to your nose and do the sign opposite. Allergies or allergic. Oxygen, as in the oxygen that you would get at the hospital. Oxygen. Medicine. Medicine. You're shaking the middle finger of your dominant hand in your palm, showing like you're holding medicine. Medicine. Drug. Drug. Drugs can come in many different forms, so it's safe to fingerspell drug. Drug. Drink. Drink. It's like you're holding the cup and drinking it. Drink. Alcohol. Alcohol. Your index and your pinky are out and on their side. Alcohol. Smoking. Smoking. You have a V-shaped hand representing the cigarette coming up to your mouth. Smoking. Pregnant. Pregnant. Your hand is moving out from your belly, but make sure you don't do it sideways and do this with it, because that would mean fat. Pregnant. Sick. Sick. When people get sick, it's typically with their head and their stomach. Sick. Cold. Cold. You're constantly wiping your nose when you're sick. Cold. Cough. Cough. And as you're signing this, make sure you do a with it. Cough. Fever. Fever. Your non-dominant hand is flipped backwards on your forehead like you're checking for a fever. Fever. High. High. You have an H hand moving upward. High. Low. Low. Your hand is moving down lower to the ground. Low. Weak. Weak. These are your legs and they can't stand up on their own. Weak. Confused. Confused. Your mind is jumbled up. Confused. Nauseous. Nauseous. It shows that your stomach is churning. Nauseous. Better or best. You have a flat hand moving up to a thumb right from your chin. Better or best. Sore throat. Sore throat. You have a G-shaped hand and you're moving it up and down on your throat with a really sad face. Sore throat. Sweat. Sweat. This is showing the sweat dripping off your forehead. Sweat. Throw up or vomit. Your hands are coming out of your mouth like you're throwing up or vomiting something. Throw up or vomit. Broken, break, or broke. This is something that is together that is now breaking apart. Broken, break, or broke. Sprain, sprain. You're doing S hands towards each other and twisting them for a sprain. Sprain. Heal or healing. You have open hands pulling up to fists. Healing, heal. Shot, immunization, or vaccine. You have a 3-hand pushing in the shot. Shot, immunization, or vaccine. Blood or blood. Red and the blood trickling down, or just showing the blood. Blood, blood. Blood pressure. Blood pressure. It's showing the act of getting your blood pressure checked. Blood pressure. IV. I and V and showing the liquid going in. IV. Surgery. Surgery. Your non-dominant palm is facing up with your dominant cutting. Surgery. Temperature. Temperature. You have your index fingers going up and down, showing the fluctuation of a temperature. Temperature. Now let's put these signs into sentences. Do you have insurance? Insurance have you? The cafeteria closes at 9 o'clock. Cafeteria closed 9 o'clock. The elevator is over there, then go to the 3rd floor. Elevator, point. Floors, 3. Where does it hurt? Hurt where? We are contacting an interpreter. Interpreter, contact right now. Okay, I know this video was a lot to cover. Hopefully it didn't overwhelm you. If somehow you are wanting even more, this video is a part of a series for public services. Be sure to check out this series in its entirety. And to not miss the next video in the series, be sure to subscribe. Until next time, keep learning how to sign.